Good afternoon, and welcome to the City of Hamilton's third staff town hall meeting regarding COVID-19 and Hamilton reopens. Once again, my name is Jasmine Graham, and I'm a Senior Communications Officer in the City Manager's Office and your host for today's staff town hall. As usual, today we're joined by a panel of senior leaders from the city. I'd like to welcome Jeanette Smith, our City Manager, Paul Johnson, our Emergency Operations Center Director and General Manager of Healthy and Safe Communities, Dan McKinnon, our General Manager of Public Works, Jason Thorne, our General Manager of Planning and Economic Development, Mike Zagaric, our General Manager of Finance and Corporate Services, Laura Fontana, our Executive Director of Human Resources, and Dr. Nin Tran, one of our Associate Medical Officers of Health. So thanks everybody for joining us today. For staff watching on YouTube or listening on our phone in line, we're here to answer your questions. And once again, we'll get to as many as we can. To submit a question for our panel today, you can email us at communications@hamilton.ca. So to start things off, I'd like to welcome our city manager, Jeanette Smith, with some opening remarks. So Jeanette, over to you.
Great. Thanks, Jasmine, and welcome everyone. Thank you again for joining us. I truly do hope you're finding these helpful. For me, I think this week, two major things happened. The province made an announcement that several more areas of the province can move into stage 3 of the provincial plan, and that includes us in the city of Hamilton as of Friday. And of course, City Hall reopened as of Monday, and things have gone very well. Just a reminder that the provincial plan really focuses a lot on public places and businesses. And while it does enable us to do some things at the City of Hamilton, our Hamilton Reopen plans is something separate. It really is about how we safely, steady, and measured bring on our city facilities and programs and services. And you will get sick of hearing us say slow, steady, and measured, because that is how we're approaching everything with reopening. We learned a lot with opening City Hall, that it's a lot harder reopening than closing things. And we had to make sure we thought through all the safety and public health measures to make sure all staff and the public who are coming to City Hall are safe. And Paul will give you a lot more details of that. And through some of your questions, we'll get to more of the details. I can never miss an opportunity when I have you all online or on the phone to say thank you. I know it's a lot of juggling, both with our personal and our professional lives, with everything that COVID's meant. But you truly have done an amazing job working together, adapting, problem solving, and making sure we can continue to provide those essential services to the residents of Hamilton. So thank you again. And with that, I will pass it back to Jasmine.
Thanks, Jeanette. So next we're going to hear a presentation by our Emergency Operations Center Director and General Manager of Healthy and Safe Communities, Paul Johnson. So Paul, if you're ready, over to you.
Thanks very much, Jasmine. And I'm going to get our slideshow up and going here. And just to kick things off and to start, I too want to say thank you because we have, through this pandemic, not only delivered a lot of services and continued to deliver a lot of services to the community, we've all had to step up in a COVID environment and provide additional support or information or advice. And that can be to members of council who are getting questions from their constituents or businesses within their wards, or it could be, members of the public or the partners that we work with. And, we've done things in big ways and we've done things in small ways around it. And I think one of the things that I want to share is that in a big sense, things like reopening businesses and childcare, I keep hearing from business owners, I keep hearing from childcare centers just how thankful they are for the work of our staff, helping them to be ready to reopen their business. And not always do they have to connect with things like our public health units or talk to other parts of our organization, but they do because they want to be safe and they want to do things well. And in the case of our childcare centers, they did. They had to have inspections, they had to have people come on site, and all I heard back was that we were very responsive, we were set up well, and we didn't delay them needlessly. And then it's the little things that are going on in our community as well. Just this morning, we facilitated a community member coming into one of our facilities to get some things. They rent space in our facilities. Of course, they've been closed for 4 months. They recognize that some of these facilities won't be opening for a little while. And we've just been there to help them get a few of the things they need out of that facility so they can do some other things. And then, one of my favorites was a grandfather who phoned. They're doing an outdoor wedding for their granddaughter in August, and happy that more people can now gather, although needing to be physically separated, and just phoned and said, hey, any piece of advice, and how do I make sure that I'm able to do this for my granddaughter and able to do it safely and able to do it legally. And providing some of that advice just makes that little bit of extra help, and it makes that stress go down just a little bit. So those are just a few stories. I like to start with some good news stuff, just some stories of the many, many, many hundreds of stories of that little extra bit of COVID-19 related service that we're providing, in addition to continuing to knock it out of the ballpark in terms of our day-to-day work. And that stuff is what really keeps us all going. So let's talk a little bit about where we are in terms of reopening. This is a slide that we've talked about a fair bit, and as Jeanette mentioned, we have moved into the provincial stage 3 of reopening. Important to recognize that while our phases from a Hamilton reopens perspective do try and align wherever possible with the provincial piece, in this case we are going to have a little bit of a divergence. We still are working through some of our phase 2 reopening as the City of Hamilton, and we are not yet announcing that we're moving into phase 3 of our reopening because we need to continue to do things right and plan for what will be some of the more fulsome opening of our services and facilities that we'll now be able to do under stage 3 of the provincial work and are located in our phase 3 of our reopening. And I get that that all gets very confusing. The numbers seem to align, the stages versus phases and all the rest. But I would just remind you that you can always go to our documents. They are online. They're readily available, and that will give you the flavor of how we're reopening. And just to reiterate today, we are in phase 2. We are not entering into phase 3 of the city's reopening quite yet. But obviously now that the province has moved forward, we'll have that ability to start to plan for those activities in the not too distant future. So some decisions that were made along the way to keep you safe. Obviously, the closing down happened very quickly, and we appreciate everybody's work in making that a success. And now we've started to gradually reopen, and it's always going to be based around this idea of safety. And whether it was how we opened up our pools, indoor and outdoor pools, whether it's how we've reopened a major city facility from a public perception perspective. City Hall opened this week, and we'll talk a little bit about that reopening. It's all done with, can we get the right things in place so that we can be safe? Because I want to pause on this slide just for a minute and talk about what we all are hearing, and what I really love about municipalities is they're all connected to these wonderful public health units that not only bring together great on the ground work, but also bring together great evidence and research around the things that are affecting our community, and the coronavirus is no different. And when we talk about safety, the things we're starting to learn as we're now, 4 or 5, coming up to 6 months in a Canadian context of understanding this virus in our community, there's a few things that are starting to emerge. That if we do things well, a so-called second wave, like a big second wave or multiple big waves of this virus, are not an inevitability. This virus hasn't disappeared. It remains in our community. The threat that we could have a large number of cases start to grow in our community is always there. But I think we're learning some of the ways that we can really curtail that. And some of them, of course, are the public health measures that we talk about all the time, that some of them are listed, if you look at this slide, which is about, not coming to work and not going out into public places when you're sick. That's a key one. But the others, of course, are remaining physically distant from people, and hand hygiene, not touching your face, particularly your eyes, your nose, your mouth. Those types of things are really important. But then there's the other pieces: intensive testing, and then case and contact management when we do have cases of COVID-19 that are discovered. And the great news is that we, alongside our other health partners, have a great testing regime that's in place in Hamilton. Our public health unit is primed and working every day around contact and case management, no question there. The ability to isolate people, and that will be an ongoing discussion we'll have, is how do we isolate cases of COVID-19 so the spread stops fairly quickly with the individual who is positive. And then the other emerging piece of work that's saying to us, here's how we can keep ourselves safe, is this community mask wearing. And as you know, on Monday, it became mandatory in the city of Hamilton in public indoor spaces. Most public indoor spaces, you need to wear a mask unless there's a medical reason. Why not? The other thing we're learning is that our focus really has to be on that person-to-person transmission of this, that those that are pre-symptomatic, just a couple of days before symptom onset of COVID-19, and those that are symptomatic account for a lot of the transmission that's occurring in our community. And I know there's lots of conversation about these asymptomatic cases or environment spread, and certainly we need to monitor that, and they do account for some cases around the world. But if we want to stop the spread in terms of the majority sense of the word, it is really understanding that when you're pre-symptomatic and when you're symptomatic, that is when transmission can occur. And that's why we've put in place a number of measures as well. It's also why it's really critical to maintain that physical distancing and the mask wearing in public, because quite frankly, on our screening, you could pass the screening questions, but still be shedding that virus because you may be in that pre-symptomatic area, as could our guests, as could the public. So those are the things that we need to keep thinking about as we move to more of the reopening. It was a little easier when not much was open, or when we were doing predominantly work outside and could distance ourselves from the public. As we move forward with the provincial reopening and our own reopening, that will become more problematic. And so we do have to think about how we're making decisions, and it is about risk-based decision making now. There's no way to be 100% safe. Well, there probably is a way to be 100% safe, but it's not a way that any of us would want to live our lives or could live our lives, quite frankly. So we need to think about the things that really make up larger and larger risk. And when we talk about low-risk activities, both for ourselves as the work we do as a municipality, but also the services we support as a municipality, it's no surprise that a lot of that is about either isolating and taking yourself away from people, which is about staying at home whenever you can and not being around a lot of people. Things like taking out food and picking up food rather than going to restaurants and sitting for long periods of time. But it's also about those outdoor activities, and that's why you've seen us really focus on our tennis courts and getting some of the amenities in our outdoor facilities opening beaches and our trails and even some of our waterfalls, so that people can get out and enjoy activity, but do so in what is a very low risk, or in some cases moving to a more medium risk with certain sports and things like that. And then you get into some of those medium areas, going to the grocery store, doing some of the shopping where you may not be there long, but you are in an enclosed space and you are around other people, although many of our retail establishments are doing well. And that's where also this idea of the mandatory masking comes into place. My mask protects you, your mask protects me from a lot of that spread of those droplets, and that can help manage our risk. In those medium risk categories that you see on the screen now, we are talking about things where you get into a little more confined space, where there may be a little less ability for there to be the physical distancing of 2 meters. Some activities in medical offices, if you think about dental visits, if you think about some medical treatments, there's just not the ability for that to be done at a 2-meter distance. There is sometimes close contact and physical contact, and so those up the risk a little bit. Things like going to even to outdoor restaurants and taking taxis or ride-saving services. Our own museums, they offer a little higher risk, but we've said, you know what, in our larger museums, we want to welcome people with the opportunity to start to come and enjoy some of those activities, and we've put in place special provisions to ensure that we can keep people as safe as possible. And then it starts to get a little higher. Things like going to the gym, which will be open, of course, on Friday. Gyms will be open, indoor restaurants and coffee shops. And the whole idea there is that you're spending more time in a smaller area with more people. And so your risk goes up. The nail salons and the barber shops have been open now for a little bit. And you'll see in Kingston, of course, if you followed that story, that they had an outbreak connected back to a nail salon and had to do their intensive public health work to do all of that contact tracing and make sure that they could contain that outbreak. And then you'll see also working in an office. long periods of time in an enclosed space. Yes, we can keep people separate, but it is one of those higher risk activities. And then you get to some of those high risk things, and no surprise here, these are the things where there large numbers of people coming together. So the good news is we are nowhere near getting back to having concerts or major outdoor or indoor events with lots of people. Sporting events are still off the table in terms of having large numbers of people and spectators watch them. But some of the things we have opened, including religious services and some of the sports that we have, and of course our public transit system, do operate in a high risk environment. And again, I share these slides with you not to say that we can't do some of these things, but it fits into the decision making. And here's the examples that I'll use. Obviously, we want to keep our public transit system moving, and we have throughout this pandemic. We haven't shut down our public transit system for one day through this coronavirus event, and we want to keep that happening. But because it's a high risk activity, we've put a lot of time and energy, and I want to thank very much all the folks involved in transit for finding the ways that we can make transit as safe as possible. And it's why we mandated masks on transit before we actually mandated masks through the broader community, because we understand that risk. So we got to keep that moving, and that means we have to make sure that we do the right things. But if we look at working in an office, those are some things maybe where we don't need to take that risk right now. There are many people in our organization that can continue to work from home. And so decisions to keep people out of offices is because it represents one of those medium to high risk areas that we actually don't need to necessarily have everybody come back into. So why would we take the energy that's necessary to mitigate some of those risks right now when we have an opportunity to keep a lot of people at home? And so where people are in offices is much lower numbers, and we haven't got our office capacity up to what it needs to be. And so, that is a little bit of the sense of how we're thinking through these next stages of reopening and the phases within the city of Hamilton. They're all predicated on those basics of our health and safety guidelines, and we update them as things change. You'll know that some of our standard operating procedures have changed now that we have public masking, or we have mandatory masking in public indoor spaces. So we're in phase two. I mentioned this, and you've seen these slides before. So we're slowly opening some more things, but generally focusing on some of those recreational activities, some of those outdoor activities, keeping big events canceled, even though on Friday we'll go to 50 indoor and 100 outdoor. Obviously, the major events like fall, some of the fall fairs have already started to cancel, and some of those large concerts and events that we love during the summer just simply can't operate under these numbers. And then we get to some of the new things that are happening. So we did reopen City Hall on Monday. It worked out really well. We had a great plan in place, and it limited the number of people that could be inside at any time. It protected staff in terms of physical barriers, also masks for staff in terms of their dealing with the public. Lots of floor markings so people knew where they were going, and greeters and people that could help make sure people got to the right area to do what they needed to do. And it was great for some, particularly in services that have been actually offline, unable to be accessed. One of those, of course, was marriage licenses throughout this first 4 months. So it was good to get some people back and doing that work. So congratulations to all involved in reopening City Hall. By all accounts, this week it's going smoothly. Not large numbers of people showing up yet, although I think we've got a tax installment that's due by July the 27th, so we might have some more people coming in next week. And there's some of the services that are there. Some are by appointment, some are by drop-in, and some are really just a pick up and drop off. We're not encouraging meetings with folks at all. For those of you who think about City Hall and what happens with the other municipal service centers, always in our plan, municipal service centers we're opening after City Hall, and that is the case here. We need to do those physical changes. We hope by mid-August that municipal service centers will be up and going, and again, those indicate a larger number of our indoor facilities starting to open. We'll also be planning for what this means for our recreation facilities. The other announcement that you may have heard and hopefully have is that for a number of divisions or sections within our organization, we've now helped you a bit with planning and said that we are not going to be, unless something dramatically changes, we're not going to be bringing back a number of divisions and sections within the city to an office environment until at least September 30th of 2020. And that's a decision that helps our staff understand what they need to be doing over the next number of weeks. So it's not a sort of week to week decision making and thinking that goes on, but it's also an indication of where we are not going to enter into some of these riskier activities at this point, because we have the opportunity to be just as productive and deliver service in almost as strong a way as we can in an office environment from a home environment, and we're going to continue to do that. So thanks very much for allowing me to take you through that. I'll stop sharing and we'll get to some of your questions.
Great. Thank you so much, Paul. So we will get to some questions now. Just as a reminder before we get started, if you have a question you'd like to submit, you can email us at communications@hamilton.ca and we will get to as many as we can. So Jeanette, the first question as usual will go to you. Let's see, how much notice will staff get when it's time for them to return to work so that everyone can make the appropriate arrangements, including childcare or other family obligations?
Thank you, Jasmine. Certainly, I think for all of us on SLT and the Emergency Operations Center, we know everyone is juggling both their personal and their professional life. So we will give as much notice as possible. I truly wish we had a crystal ball as we've gone through this. Sometimes we've had to make some quick decisions, and we will certainly, if that happens, that it changes on where your work location is, we will get to you as soon as possible so you can make those arrangements.
Great, thank you, Jeanette. Next question will go to Jason. So Jason, through the emergency, while many of us continue to work from home, parking spots are being reserved for those who are fortunate enough to have employer-paid parking. However, those of us who have to pay for our own parking passes either have to continue paying $100 per month or go to the bottom of a list that's sometimes 2 years long. It doesn't seem very fair. So could you comment on that one?
Yes, so you're right, Jasmine. What we have offered to people if they is that they can cancel their parking pass if they wish to do so. But if that is the case, then we do need to free up those spaces and offer them to others, which means you would be returning to the waiting list, which depending on where you're parking could be a lengthy waiting list to come back online. And there's a couple of reasons for that. One is that if we're just holding a space, it means that space is sitting empty and is not available for anyone else. So it's not a very efficient way to use our parking system to have spaces just sitting vacant when we know that there are individuals who do want to use them. And if we are just holding them, waiting for someone to come back and to start paying again for a monthly pass, then we can't do anything with those spaces. And I would just say that this is not, we also obviously provide parking to a number of other employers, not just the city of Hamilton, and we're treating all employers the same. So if they are, we have a number of customers who work in other office buildings in the city, and the same principle and policy applies, that if they want to cancel their parking pass, they can, but we would free that up then to give to someone else, and that individual would have to go back on the waiting list. And it's similar to what the private parking operators are doing as well. So yes, the option is if you do want to cancel your parking pass, you can, but then you would be going back into the queue, which means you could be waiting a while to get back into having a parking space if and when you return to your workplace.
Great, thank you, Jason. It's a great explanation. Okay, next question will go to Paul. So Paul, you did mention that we are going to be keeping a number of staff working at home until at least September 30th. So are we expecting that this will also be the date that we all return back to the office? And how will that work? Will there be a rotational schedule or other adjustments that we should be prepared for?
So the reason we made this decision is so that we could give some indication to folks rather than this kind of week to week thing. And we also realize in the summertime, people are taking vacations. And so you don't want to, well, while you're away on vacation, suddenly realize that a few days from now, you're coming back to the office. So we thought by giving that date and making it a significant chunk of time away, that would be helpful for people's own personal planning and allow them to get their work space at home in order and keep doing the things they need to do. In terms of what happens as we get into September, unfortunately, there's still a lot of question marks. I would suggest that it would take a series of fairly miraculous things to happen to say that on September 30th or the day after, everybody just arrives back to their office environment. I think that there will be, again, some work done in terms of how that looks and who would come back first and how we would stagger that a little bit. And the other thing is, as the person who asked the question, understands, is there may be some of these different work environment or work arrangements where you may not work the entire week. So all of those things are on the table. We can't say for sure today. This gave us a little bit of breathing room to see what happens, and in particular, I'm very interested to see what happens as Hamilton moves into stage 3 provincially, and we see a lot more of these commercial operations open up and gyms in operation and indoor restaurants and bars in operation. I really want to see how that affects our case numbers and take a lot of cues from public health about just how well we're doing in terms of our approach to indoor spaces, of which our offices are part of it. So we'll be analyzing this through August and coming out with some direction for folks as we head into September.
Great, thank you, Paul. So just as a reminder to everybody watching, if you have a question that you'd like to submit, you just email us at communications@hamilton.ca and we will do our best to get to as many as we can. There's quite a number coming in today, so I will do my best to get to as many as I can. Next question goes to Dan. So this question is about 100 King Street West. So the question says, we've had a number, we have had a number of questions about this. So there's a number of staff moving over to 100 King Street West in the coming months. So given the smaller size of the cubicles and the number of people on each floor, it appears that staff might be quite close together and might be unable to keep 6 feet of physical distance. So are there any changes being made to ensure that staff have the appropriate separation? Or will staff working at 100 King Street West have to wear face coverings? And could you maybe talk a little bit more about that?
Sure, thanks, Jazz. And I just want to say you're doing an excellent job. So the move over to King Street, the furnishings that are being installed over there follow our corporate standards. So they are a little smaller than maybe what some people are used to. So that may create some challenges. And I'm always careful not to be too definitive about what I say, because each workplace is likely going to have an evaluation done with respect to what's going to occur in those workplaces. But generally speaking, in an office environment like that, where you have these smaller workstations, we're likely going to have to go to maybe kind of a staggered shift where we may not have everybody in the office every day of the week. And we may have to have different shifts coming in, different group on a Monday versus a Tuesday and that kind of thing. Where there are areas where we are going to be expecting people to gather a little closely for a longer period of time, we have procedures for that now. And so I would encourage people to review the procedures and make sure they understand them. And if there's any question at all, to go to your local leadership, wherever you are, to get some guidance on that. I think I always go back to the kind of the hierarchy of controls around infection control here. And it's about keep your distance, it's about washing your hands, and it's about wearing masks. So our recently approved procedure does give the authority for staff to have masks depending on what encounters are happening in their workspace, and it will be different in each workplace. So as far as King Street, that's where we are with it. We really haven't changed our corporate standard, but we will be looking at what's going on in any one of those individual spaces to make sure that we're either providing the distance or the PPE that we need to in order to make sure that everybody's safe there.
Great, thanks, Dan, and you're doing a good job too over there. So next question will go to Mike. So Mike, we have had this question before, but we did get it a number of times today. So as our staff continue to work from home longer and longer, and we're expecting to do so over the coming months into the fall, perhaps you might have an update on this. So will employees who are continuing to work from home have the ability to make any additional income tax claims on their taxes next year?
Thanks, Jasmine, for the question. And I do recall having this question in past town halls. So my answer hasn't changed, but it's something that we are monitoring. Just as a reminder, working from home and having the eligibility to write off some of those expenses are typically tied to two conditions. One is the requirement by your employer to work from home a majority of the time. And our good friends at Canada Revenue Agency, their test is that in a typical tax year, you were required to work from home 6 months out of that tax year. This is a bit of a different situation. People are working from home, as Paul described this afternoon, in response to trying to manage the risk as it relates to this crisis, and our way to try to protect others in our community. So there isn't necessarily clarity as to how CRA would interpret staff having to work from home under these circumstances or conditions. The other test that CRA typically relies on is if you're working from home, that you would entertain face-to-face meetings. So understanding that under the current environment, we don't encourage face-to-face meetings. We interact, such as this afternoon, through virtual meetings. So again, some lack of clarity from CRA as to how they would interpret or require staff facilitating face-to-face meetings. So again, answer really hasn't changed. We're still monitoring. We're not alone. City of Hamilton's not alone. This is a question that other municipal employees in other jurisdictions are asking. We're having these conversations around the treasurer's table. The final component to this discussion would be that municipalities would have to enter into some employment contracts with staff if staff were given this opportunity. This may change going forward. The way that we operate in terms of accommodation strategy may change. But Jasmine, unfortunately, I don't have any additional information that would change the position the city's taking, and it is consistent with what position other municipalities are taking at this time. And we are following up with CRA to see whether or not their requirements might change. That could trigger a change in our position, and we would bring that back to staff.
Great, thank you, Mike. That's really helpful answer. Next question, we're going to go to Laura. Laura, what options does someone have if they are uncomfortable returning to work, but they have been recalled to the office? We'll just get you off mute there, Laura.
My apologies. Thanks, Jasmine. So there have been many health and safety measures that have been put in place, obviously, to ensure the safe return of employees into the workplace. And for example, the health screening tool, employees must ensure that they pass the screening test on a daily basis. All of our areas are going to be cleaned and disinfected on a regular basis. There'll be barriers in place, for example, to ensure public entry is prohibited into the workspaces. Paul, for example, spoke to the staggering of employees back into the workplace. So we're going to limit the number of employees that are in particular areas. So we're not crowding in particular areas of the office, ensuring that physical distancing, of course, encouraging employees to practice the proper hand hygiene, ensuring all those proper protocols are practiced on a regular basis, the PPEs. All that is, continues to be monitored and regulated. Returning into the workplace in September is going to allow us more time to prepare so that employees do feel safe when they do return into the workplace. And again, limiting that number of employees so that people don't feel crowded, they don't feel compromised. And it's absolutely understandable that people are going to feel nervous about returning into the workplace and the exposures, and not only for themselves, but for their family members. So these are very strong considerations that need to be addressed. But having said all that, and if employees do continue to feel compromised or afraid of returning into the workplace, they should speak with their supervisor to address some of the concerns. They can take vacation days, leave time off, perhaps unpaid time off if that's something that works for them. They can also contact our Health and Safety Division in Human Resources to get that, that clarity that level of comfort so that we can make arrangements for employees to return and feel safe when they do return to the office. So this is certainly not an exercise in forcing people back into the office when they don't feel comfortable. We're obviously going to do whatever we can to make them feel safe and comfortable and put whatever measures are in place. And again, it's going to be a process. It's going to be something that we have to deal with and ensure that people are comfortable when they return back to work.
Great, thank you, Laura. Next question goes to Dr. Tran. So Dr. Tran, earlier this week, masks or face coverings became mandatory in public enclosed spaces in Hamilton. Can you talk a bit about why this bylaw around mandatory masks or face coverings came forward now and when the number of COVID-19 cases in Hamilton is quite low?
Thank you, Jasmine, for the question. I think there are two reasons. I'll touch upon the first reason, which is our main reason, is in terms of our understanding of COVID continues to evolve. Once we had the outbreak in March, and we continued to monitor not only our cases, but in terms of the understanding of the science behind it, and any research done in terms of effective public health measures. I think you've seen that our position on mask or face coverings have evolved as we learn more and more about COVID-19 and what has happened around the world, and other research has have occurred. As a couple months ago, that became like a recommendation to wear masks out in public, and then it was just more the final step as we continue to look at the research, and there's some new additional research, further strengthening the relationship between universal masking and seeing that in addition, countries that had adopted policies or had high levels of mask wearing had significantly lower rates of COVID-19 as well as deaths from it. So that clearly was a driving factor that continued to strengthen the evidence. And then the second part of a more contextual perspective in terms of reopening. And as we were in stage 2, and we were thinking about how we would prepare for stage 3, and as additional reopening plans were happening provincially, it was also, from a timely perspective, as we increase exposure risk, it would be prudent to increase additional public health measures such as masking or face coverings as a mandatory measure, and we've focused on enclosed or indoor spaces, given that's where the risk is, and it's to prevent hopefully, as Paul has mentioned, in terms of as initial measures to prevent any significant second wave or resurgences.
Great, thank you, Dr. Tran. So we'll move on to the next question, goes to Jeanette. So Jeanette, we already talked about staff continuing to work from home if they are so now up until at least September 30th. So that's kind of the background. If staff are able to continue delivering 100% of their job responsibilities successfully from home, will the city consider looking at extending work from home opportunities into 2021 or possibly longer?
Thanks, Jasmine. So I think when you heard Paul's presentation about kind of that risk assessment, we do know that, bringing people into an office who really don't have to be here to deliver our service is not something we want to do from a safety perspective. So certainly while the virus is still circulating, telecommuting and working from home where the services can be delivered in that fashion will continue to be a key part of our COVID response, because it will enable us to ensure we can keep that physical distancing, which is a key public health measure, and allows us to keep the staff who need to come in and the public who need to come into our spaces safe if we keep as many people as possible working from home. In terms of it being more of a permanent situation, like more telecommuting at the city, certainly everything we're putting in place right now is in relation to the COVID response and the virus circulating. Will telecommuting play a bigger role in how the city delivers services in the future? Potentially. I think we're going to learn a lot from going through COVID about how working from home can happen, how technology can be used, how we can do things more virtually. But I think we're also learning that having that human interaction with our colleagues is kind of a big part of work, and what are we losing by doing it all? So everything we're putting in place right now is in response to COVID-19 and keeping everyone safe. We do know at some point we'll be looking into the future beyond this pandemic when we have a treatment or vaccine. And so time will tell. And we know as senior leadership team, that's something we'll be looking at into the future. Thanks.
Thanks, Jeanette. So just as a reminder before we move on, if you do have a question that you'd like to submit, you can just email us at communications@hamilton.ca and we'll do our very best to get to as many as we can. So next question will be to Paul. So Paul, there is some confusion on whether masks or face coverings need to be worn by staff if they're working in areas where the public isn't ordinarily found, but might have access for an appointment or could be dropping in for a meeting. Could you talk a little bit about that?
Sure. So if it's an environment that the public don't normally attend, the answer is no, it's a workplace and therefore you'd follow our guidelines around that. And if there is a one-off situation where someone from the public comes in for a meeting, I mean, that's not the kind of, that's not the reason that this bylaw was put into place. However, if environments do start to say, well, we're having regular meetings, which we would discourage in the first place. But if that does start to happen, then the answer would turn to yes. So if there's a regular expectation that the public is coming into a space, then it really does turn into a public space, and we'd have to look at that. But generally speaking, if there's a one-off situation here or every long once in a while situation, that's not the intent of the bylaw. That means, you know, that space is really a workspace and the public don't have access to it. And the other thing we can do is, if that's occurring, have that meeting somewhere else, have that meeting in a public space, which would then require, of course, both parties, our staff as well as the public to wear a mask. And that's also a stronger way of protecting the overall safety of the space that we're trying in some cases not to be public access. The level of cleaning and the level of work that we do to keep everything safe in our public settings, you know, is not vastly different from our office areas, but we do have a heightened sense of what we need to do with the public involved. So the more we can keep our work areas, and our public areas, the best. But if you do get that rare situation where someone from the public is showing up, if you can physically distance and all the rest, that's perfectly fine. We don't need the entire office wearing masks all the time, just on that off chance that somebody drops by.
Great, thank you, Paul. Next question will go to Jason. So Jason, what should staff do if they see members of the public in city facilities in the public areas, but the members of the public are not wearing masks? So how, if at all, are city staff supposed to be enforcing mask wearing?
So thanks for the question, Jasmine. And we do actually have designated staff who are playing that role right now as facilities are opening. So anybody who has been to City Hall this week will know that we have greeters, screeners who are outside of City Hall screening the public before they go in, advising them of the mask requirements, advising them that they don't have a mask, that they should go and get a mask and return when they have one. And we have security personnel as well inside our city facilities. So those are the individuals whose job it is to be monitoring and making sure that any public coming into one of our open facilities is wearing a mask. Other staff, that's not part of their job requirement. That's not part of their job duties. So the staff who are designated for this role, they've had the training, they've been provided the scripts, they know who to contact if there are issues. And so that will be their role and responsibility, not the role or responsibility of other staff. So other staff should not be you know, approaching or challenging someone if they see someone that they expect may be a member of the public not wearing a mask. And then, as always, if you ever suspect any sort of concerns or issues in any workplace, you have your contacts in terms of security personnel, others you can call if you expect that there's an issue. But I think the short answer to your question is that in open workplaces, there are people who have that as their designated role. And for others, they can go about their business, and that's not something that they have to take responsibility for.
Great, thank you, Jason. Next question will go to Dan. So Dan, for those staff who are back in the office and are looking to eat lunch or take a break, are the kitchen areas and break rooms open for use? Are there any special guidelines, or should lunch be eaten at your own desk?
So lunchrooms and break rooms will be open, depending on the size and the orientation of the rooms themselves. There will be limitations to the number of people that can actually sit there and have their lunch. So again, going to be asking people to kind of be conscious of those infection control principles. Uh, there will be signage in these locations as well to remind people about the capacity limitations of any of those rooms. And we would encourage people to, kind of do a good job cleaning up behind themselves, because we know that washing your hands and keeping surfaces clean is an important part of the approach here. There are some of our workplaces where you may have to walk through a public space to enjoy your lunch. And so just again, reminding people that if they do have to leave their kind of closed workspace to go through a public space in order to have their lunch time, then they'll need to put a mask on to do that. But the short answer is yes, they'll be open, but there will be posted guidance around how to use those spaces.
Great, thank you, Dan. Next question is for Mike. So as a bit of a forgetful person myself, I'm quite interested in this answer. If I arrive at work and I've forgotten my mask or my face covering, but I need to travel through a public space, what should I do? And will there be any available for use?
Oh, you should have given this to another SLT member, Jasmine. I'm forgetful too. So I wish I was a Boy Scout because maybe I would have learned something about being prepared. I too forget. I'll forget my access card, my wallet, keys. I think as Dr. Tran made reference to sort of this evolution around masks, what I found myself doing is leaving an extra mask in the car, glove compartment. I now carry a few masks in my backpack if I required to come into City Hall. So I think we need to get into the habit of beyond maybe masks is hand sanitizer or masks, just being prepared for those situations that require us to be a little cautious. And as it relates to City Hall, in the interim period, as we've opened up City Hall this week, and given that we now have a mandatory requirement as it relates to wearing masks or face coverings in indoor public spaces, Jason alluded to greeters here at City Hall. Greeters will have some disposable masks available to staff on an interim basis. We do encourage you to start to grow accustomed to carrying masks with you, maybe carrying some extra masks. So again, greeters, suggest that you also call your supervisor. Maybe your supervisor can accommodate. Just remind everyone to maintain the social distancing. So if you are approaching the greeter or if you are approaching the reception desk at City Hall, just respect the social distancing. And on a personal note, this past Sunday was the first time I was able to visit our 93-year-old mother who lives in a long-term care home, and they reinforced the importance of wearing masks and the social distancing and all of the measures that public health have developed to try to keep our community safe. So to all the individuals wearing masks and practicing the social distancing, thank you. Again, on a personal note, it was a great opportunity after 5 months to finally spend some time with our mother, and looking forward to doing that going forward. So thanks. And Jasmine, not sure if I instilled any knowledge and helped you, but again, just encourage everyone to maybe carry some extra masks and leave some in your purses or cars.
Thanks, Mike. It's good advice. Next question will go to Paul. So we did get quite a number of questions around childcare. There's still a lot of uncertainty around kids returning to school in September, childcare spaces, and what may or may not be available for parents once they're recalled back to the office. So can you talk a little bit about what would happen if someone is unable to return to the office because they have either childcare or other family needs, whether if they can't return full-time or part-time, what kind of options they might have?
Sure. Well, in that case, if all options have been exhausted and it looks like for a long period of time, either childcare issues or care for other family member issues are going to impact the ability of that individual to work or return to work, then you will need to talk to your supervisor and talk to HR about the options that are available. And some of these were around as issues for families pre-COVID-19, caring for family members and things like that. And so you would be looking at the kinds of things that Laura talked about in the past. If people are feeling uncomfortable about coming to work, it's those types of things. It may be vacation or leave time or leaves of absences that have to kick in. So if it really looks like that is happening in the situation of an employee, the earlier you can start talking to your supervisor, the earlier you start talking to HR about what's possible, probably the better on that. So that's the answer to the question. I do want to provide just, I think what are little glimmers of hope around this issue. You've seen that as of Monday, because we are moving into stage 3, that the cohorts for childcare centers have increased. So they will go up to 15. So there are more children that will be able to access childcare in our community and other communities that are already in stage 3. And there is an ongoing series of conversations happening about how childcare gets back to full capacity, really in terms of getting there for the fall. The second thing is you've seen a fairly significant shift in push from both the provincial government as well as local school boards that are ultimately responsible for their plans to find ways that children, particularly at the elementary school age, can be in school full time. And so I think that what has happened through the dialogue and the debate publicly is really good. And that is that the workaround of part-time in school, part-time out of school for kids that are sort of under the age of grade 6 or 7, it just doesn't work from a family dynamic, and it really doesn't work from an economic dynamic. Child care centers cannot pick up the load. They cannot step in and provide that extra care and they'll fill that extra gap. So I'm pleased with where the conversation is going. We're sitting here in the fourth week of July. My hope is that we see some very positive things coming out from a school perspective, and then we also see some things coming from a childcare perspective that allow us to get to that capacity. So I add that at the tail end because I think if we were sitting here with no movement on those fronts, I'd be feeling a whole lot more panicked. But I do think that as we move towards the beginning of the school year, I think the heads are going to come together and say, how can we support families to not have those long-lasting childcare issues?
Great, thank you, Paul. We'll go back to Dr. Tran for the next question. So now that masks are mandatory, do staff still need to worry about keeping 6 feet of physical distance while they're in the office or maybe anywhere else?
Thank you, Jasmine, for the question. I would say yes. I mean, in terms of masks are an additional precaution to what the recommended public health measures that we're talking about. And there's been allusion to it earlier in the conversation about the hierarchy of controls. As you would know through the Hamilton Reopen plan, the PPE part is the fourth pillar, but it's the lowest impact. So we're talking about using masks in addition to hand hygiene, physical distancing, administrative controls, engineering, workspace rearrangements, and working from home, that type of thing as a broader measure. So it would be in addition. And masks, I also want to reiterate, it isn't 100%. And the idea is to have a high enough uptake in the public that you reduce community transmission. And again, the mask is as a source control measure. That my mask protects you, your mask protects me. But it would be in addition to physical distancing measures.
Great, thank you, Dr. Tran. We'll go next back to Dan. So Dan, will the city be providing masks to those staff who work in areas where the public has access, or to those who need to pass through public areas in order to access their office?
So just continue to reference that we have a procedure that was established as a result of the pandemic around which staff are eligible for masks in their workplace. So we'll rely on that first of all. Now that the bylaw has passed and we now have public entering some of the spaces where staff work, Again, try not to be too definitive because it will rely on those specific circumstances. Because in some places you have counters where there may be plastic barriers between our staff and the clients. And in those situations, it may not be necessary for a mask. But if there's a situation where you have to interact directly and that physical distancing that Dr. Tran referred to is not possible, then in those circumstances, we would be providing masks to staff. Generally, for now, if all when you're accessing your workplace and you have to go through a public space and you don't interact, there's no other activity associated with your work where you would be required to have a mask, then we'll be relying on people to bring their own masks. That's travel to and from the workplace. And if in order to do that, you have to go through a public space, we would see that as an individual responsibility. But things will continue to evolve, and we'll continue to use that hierarchy of controls in every specific situation to determine when we need masks and when we don't.
Great, thank you, Dan. Next question, we'll go back to Laura. So what are the rules related to self-isolating if you're traveling this summer? So while the borders are closed off, staff still could travel within Canada. So is it necessary to self-isolate if you're traveling within Canada? And will staff be still paid if they need to self-isolate when they come back from travel?
So thanks for the question, Jasmine. So if you're traveling within Canada, it's not necessary to self-isolate unless you're experiencing some symptoms. If you are traveling internationally, and which includes the U.S., you will indeed have to self-isolate. That's not to say, though, that during that self-isolation period, that if your position or your job is conducive to working from home, then you can continue to do so, provided that you're physically able to. You should consult with your supervisor if you're able to continue with the work plan. But if you are traveling outside of Canada, I mean, obviously you need to consider whether or not you are going to travel outside only for essential travel. But if your job is conducive to working from home and during the self-isolation period, then you can do so safely and productively. If you're returning from international travel, it's encouraged that you conduct the COVID test to see if you are exposed in any way. And certainly if you have any symptoms, you should test yourself. But we encourage, working from home as best as possible. Obviously discouraging international travel as much as possible unless absolutely necessary. But if you are able to work from home and you're feeling up to it, regardless if you've traveled within Canada or internationally, you should continue to work from home.
Great, thank you so much, Laura. Jason, I think we're going to go back to you. So we have talked a little bit about face-to-face meetings, but I'd like to just come back to this question one more time because I think it's important. So once staff are able to return to the office, whether that's September or another time, whether they're on a full-time or rotational basis, what will face-to-face meetings look like during that time?
So when staff do come back to the workplace and when workplaces start to reopen, there will be some meeting rooms and boardrooms, not all meeting rooms and boardrooms, but some of them will be available for in-person meetings. But that said, there will be restrictions and modifications such that what I would expect is that most meetings, even once staff come back to the workplace, most meetings are still going to be happening virtually. Because even where there are meeting rooms that are open, as Dr. Tran mentioned, the physical distancing requirements are still in place, which means the capacity of those meeting rooms will be very, very low. We don't want to have staff from other divisions going back and forth between different city buildings or up and down between different floors to meet with different staff in different sections. So that's going to create a limitation on in-person meetings. And even if you have some staff back in the workplace, there's a good chance that other participants in a meeting or that you need in a meeting may still be working from home and having to participate virtually. So for those, as well as some other reasons, I would expect that even though there will be some meeting rooms open and available to have in-person meetings, that the actual likelihood of having a lot of face-to-face meetings will be low. They will tend to be very brief, small, within your own team meetings, potentially. But for the most part, I think people should expect that we're going to be doing virtual meetings for quite some time, even after workplaces start to reopen.
Great. Thank you so much, Jason. So we are just about out of time for the town hall event today. Before I wrap up, though, I would like to once again thank Jeanette, Paul, Dan, Jason, Mike, Laura, and Dr. Tran for participating today. As well, I'd like to thank the communications team for their support in the background and Cable 14 for leading the production of the town hall event. As usual, Cable 14, you guys are fantastic. Thank you so much. So to staff, please remember to keep up to date and informed on our continued response to COVID-19 and our progress as we now continue to slowly reopen municipal facilities and restart the city services and programs that were modified or canceled due to the pandemic. I would encourage you to keep visiting eNet, Howie, and hamilton.ca/reopens for more information. And with that, Jeanette, I'll pass things over to you and you can wrap up for us.
Thanks, Jasmine. And once again, thank you for being our host and keeping us all on track. And a big thank you to Paul. Paul continues to bring the evolving science and evidence with the support of public health to the senior leadership team. And we really, really appreciate it. And I especially like the risk assessment and kind of the different levels of risk, because not only is that helpful from us making decisions on our own city services and programs and reopening, I think it's also helpful for all of us as individuals in our day-to-day lives to just be very conscious. It gets kind of easy to forget the virus is out there when the numbers are low and you start seeing things to reopen, but it is still in our community. And as Paul mentioned, it's not inevitable that we have to have this big second wave. We all can play a part in preventing that from happening. So remember, the virus is still there. Please know, first and foremost, on behalf of the senior leadership team, we're putting your safety and the safety of the public who interact with us first and foremost in all our decisions. We want to keep you safe. If you have concerns, please raise them for the supervisor, and we'll continue to bring you updates. And thank you again for everything you're doing on a day-to-day basis to keep all our services available for all City of Hamilton residents and businesses. We'll look forward to seeing you soon. Please be safe, and thanks for joining us.